scientists reveal the tea that's restoring the memory of thousands of seniors. Those words grab attention. They promise a simple fix, a warm cup, a single ritual, and suddenly the hardest little losses of memory start to come back. I want to begin with that headline because it's a doorway. There is something real here, but it's not a miracle in a mug. What researchers and clinicians are pointing to is this. A simple, nutrient-minded morning ritual can be part of a wider, evidence-informed approach that helps many older adults feel clearer. But it's almost never the cup alone. It's the cup plus diagnosis, plus correction of underlying issues, plus sensible habits. If you're over 50 and you're noticing slips, walking into a room and forgetting why, or more frequent blank moments, consider scheduling basic blood work and bring a short symptom log to your clinician. That simple step can change everything. Think of the brain like a house full of electrical wiring. Neurons are the wires. Myelin, a fatty sheath that wraps those wires, is the insulation. When insulation is damaged or thin, signals slow down, lights flicker, and things that used to work smoothly begin to stutter. Vitamin B12 is one of the nutrients that helps keep that insulation in good shape and supports the chemical reactions the brain needs to send and receive messages. When B12 levels fall, the wiring doesn't short out entirely. Often it just gets sluggish. People describe it as more frequent tip-of-the-tongue moments, slower thinking, more difficulty holding on to recent details, or more blanking out when trying to find a word. Those are the kinds of memory slips that sometimes respond to treatment. Why does B12 drop in older adults? There are a few common, understandable reasons. As we age, many people produce less stomach acid. Acid helps release B12 from food, so less acid can mean less available B12 even when dietary intake is reasonable. Certain medications are also implicated. Metformin, a common diabetes drug, and acid-suppressing medications like proton pump inhibitors or H2 blockers can reduce B12 absorption over time. Gastrointestinal conditions, prior surgery, celiac disease, inflammatory bowel disease, or infections that affect the gut lining can interfere with absorption. Finally, strict vegetarian or vegan diets can lead to inadequate intake unless there are fortified foods or supplements, because reliable food sources of B12 are mostly animal-derived. The key point, someone can eat reasonably well and still be low in B12 because of how their body handles it. I want to share two brief stories from clinical practice because real people's small gains show what's possible. A woman in her late 60s came to clinic worried she was losing it. She was misplacing a few items, pausing more to find words, and felt less confident in conversations. Her primary care doctor checked basic labs and found a low serum B12. After further testing and a carefully supervised treatment plan, she had modest but meaningful changes. Fewer blanking episodes, quicker retrieval of names, and more ease in social outings. She described the change not as a dramatic cure, but as a return of small, important moments she had begun to lose. Another patient, a man in his early 70s, had both low B12 and untreated sleep apnea. Once both issues were addressed, B12 replacement under medical supervision and initiation of sleep apnea treatment, he reported better day-to-day clarity and steadier energy. These examples show two things. First, memory problems often have multiple contributors. And second, addressing those contributors under clinical care can produce real but individual improvements. If you're wondering how clinicians decide whether B12 is playing a role, the testing approach is straightforward but layered. The starting point is a serum B12 level, which measures how much B12 is in the blood. But a single number doesn't tell the whole story, because the blood number can sometimes be misleading. That's where functional markers come in: methylmalonic acid, MMA, and homocysteine. Both rise when B12-dependent processes are impaired. MMA is especially useful because it becomes elevated when tissues aren't getting enough active B12. Think of it as a functional alarm bell. Homocysteine also tends to increase when B12, folate, or B6 are low. It's a broader metabolic signal. Clinicians often pair the serum B12 with MMA and homocysteine to get a clearer picture. In addition, a complete blood count, CBC, with mean corpuscular volume, MCV, can reveal characteristic changes in red blood cells that point toward deficiency, though notably, neurologic symptoms can appear without dramatic blood changes. Some labs offer active B12, holotranscobalamin, which measures the fraction of B12 available to cells. This can add useful information. If you see a pattern of low serum B12 together with high MMA, that's a strong indication that tissues are short of B12 and treatment is warranted. If the serum level is borderline and MMA is normal, clinicians may monitor, evaluate for other causes, or sometimes try a monitored supplementation trial. There are practical, general treatment strategies clinicians commonly use, depending on the situation. Oral high-dose B12 is effective for many people because a portion of the vitamin can be absorbed by passive diffusion even when normal absorption mechanisms are impaired. Clinicians sometimes use daily oral doses in the range of 1,000 to 2,000 micrograms for replacement. That's an example of a common approach, not a prescription. In cases of proven malabsorption, such as due to pernicious anemia, significant gastrointestinal surgery, or severe neurologic symptoms, intramuscular injections are often recommended initially because they bypass the gut entirely. A typical pattern some clinicians use is an initial series of injections to refill stores, followed by maintenance injections at longer intervals. Again, exact timing varies with the underlying cause and the clinician's judgment. The timeline for improvement differs by system. Blood counts can normalize within a few weeks, while neurologic and cognitive improvements often unfold over months and may be partial if treatment is delayed. Always discuss options with your clinician before starting any regimen. They can individualize dose and route, monitor response, and check for interactions or underlying causes. This is where the headline tea ritual fits. The tea and similar warm, nutrient-focused beverages does not supply B12. Plants and herbs on their own are not reliable sources of active B12. What the tea can do is threefold. First, it creates a reliable, enjoyable morning habit that supports adherence to brain-healthy behaviors. People are more likely to take a clinician-recommended vitamin or fortified drink consistently if it's part of a pleasant ritual. Second, many teas and herbal infusions are rich in antioxidants and anti-inflammatory compounds, polyphenols from rhubarb, ginger, cinnamon, turmeric, and berries that can reduce chronic low-grade inflammation and support vascular and metabolic health, which are important for cognitive function. Third, pairing the warm beverage with a B12-containing or fortified element like fortified plant milk, a spoonful of fortified yogurt, or a clinician-advised supplement can make it easier to ensure someone actually receives an effective source of B12 each day. Put together, this habit supports the larger evidence-based steps: diagnose, correct deficits, and sustain brain-healthy routines. Let me give you 2 practical tea recipes you can try at home. These are presented as lifestyle ideas, not treatments. If you suspect deficiency, the priority remains testing and clinician-guided correction. Option A: warm ginger cinnamon turmeric infusion. Fill a mug with hot water. Add a few thin slices of fresh ginger, a small pinch of ground turmeric or 1/4 teaspoon fresh grated turmeric root, and a light dusting of cinnamon. Squeeze in a splash of lemon to brighten the flavor. Let it steep for 5 to 10 minutes, then strain if you used fresh root. Pairing suggestion: pour the hot infusion over a small cup of fortified plant milk. Many oat, soy, or almond milks are fortified with B12, or enjoy it alongside a B12 fortified yogurt or a clinician-advised supplement. Why this helps? Ginger, cinnamon, and turmeric bring anti-inflammatory polyphenols, the warmth and flavor make the ritual appealing, the fortified milk or supplement provides a reliable source of B12 when recommended. Option B, rhubarb and blueberry warm drink. Steep a rhubarb tea bag or loose rhubarb leaves in hot water for 5 minutes. Stir in a spoonful of mashed blueberries or a small spoonful of blueberry compote and a pinch of cinnamon. Rooibos is caffeine-free, pleasantly mild, and pairs well with fruit. Pairing suggestion: stir in a fortified beverage or consume alongside a B12 fortified cereal or milk substitute. Why this helps? Rooibos and blueberries are high in antioxidants that support vascular health and may help preserve cognitive function. The fruit adds flavor and extra polyphenols. A few practical points about the ritual. Make it early in a quiet part of your morning. Pair it with hydration. A lost glass of water first thing helps. Add a brief stretch or a 2 to 3 minute cognitive activity, like reading a short poem aloud or naming as many animals as you can in 1 minute. Those small pairings, hydration, movement, cognitive engagement, amplify the value of the ritual. Remember, the tea itself is not giving you B12. It is helping you build a pattern that supports testing, supplement adherence where needed, and overall brain health. When discussing testing and treatment, it's important to set expectations. If B12 deficiency is identified and treated promptly, blood markers typically improve within weeks. For example, anemia or abnormalities on a CBC often correct within a few weeks under replacement. Cognitive or neurologic gains are more gradual. Many people note subtle improvements within weeks to months. For others, it can take several months for meaningful recovery. Some aspects may not fully return, especially if the deficiency was long-standing and caused structural nerve changes. That's why early notice and prompt evaluation matter. If you or a loved one have had progressive symptoms for a long time, treatment can still provide support and sometimes halt further decline, but full reversal becomes less likely the longer a deficiency has been untreated. It's also essential to recognize red flags that demand urgent attention and clinician evaluation. Seek immediate care if memory problems are accompanied by any of the following: sudden, rapid worsening over days to weeks, new problems with balance or frequent falls, new numbness, weakness, or tingling, especially if spreading or asymmetric, sudden and severe mood changes or personality shifts, new difficulty speaking or understanding speech, sudden vision changes, or signs of infection or bleeding with low blood counts. Those symptoms can indicate other serious conditions: stroke, severe infections, rapidly progressive neurologic disease, or complications from advanced deficiencies, and they require prompt medical assessment. For people worried about medications and diet, there are practical steps to take without panic. If you are on metformin or an acid-suppressing medication and have been on it for years, ask your clinician if B12 monitoring is appropriate. For many patients, periodic B12 screening makes sense. If you follow a vegetarian or vegan diet, make sure to include fortified foods or a clinician-recommended B12 supplement. Relying on plant foods alone is not a dependable source of active B12. If you've had gastric surgery, bariatric surgery, or have known gastrointestinal disorders, discuss baseline and periodic B12 checks with your clinician because your absorption may be chronically reduced. Let's talk briefly about how clinicians choose between oral and injected B12. This is where the details matter and where the clinician's judgment comes in. Oral high-dose B12 takes advantage of passive absorption. A small percentage of a high oral dose crosses the gut lining even without intrinsic factor or normal absorption. That makes it effective for many people with mild to moderate deficiency or dietary causes. In contrast, injections are often preferred when there is evidence of severe malabsorption, such as pernicious anemia, in people with significant neurologic symptoms, or when a rapid refill of body stores is required. Another reason for injections is adherence. If someone struggles to reliably take daily pills, periodic injections administered in clinic ensure delivery. Common clinical patterns include an initial loading period of more frequent injections, for example, weekly or every few days for a month, or an initial series of injections followed by spacing out to monthly or quarterly maintenance shots. For oral regimens, clinicians might advise daily supplementation in the 1,000 to 2,000 microgram range while monitoring labs. But again, these are examples, not instructions to self-medicate. Monitoring response involves repeating labs at intervals that clinicians choose based on the severity and cause. A reasonable pattern is to recheck serum B12 and functional markers after several weeks to months to confirm correction and to assess whether symptoms are improving. Cognitive tasks and symptom logs can be a helpful adjunct to lab values. Small functional gains, like fewer tip-of-the-tongue moments or improved stamina for conversations, can be meaningful even before full laboratory normalization. Beyond B12, a larger picture of brain health makes a difference. Sleep is foundational. Aim for consistent sleep duration and quality. Most older adults do best within a roughly 7 to 9 hour window of restorative sleep. Untreated sleep disorders, like obstructive sleep apnea, fragment sleep and impair daytime cognition. Treatment of sleep apnea can therefore produce measurable cognitive and mood benefits, as in the man I mentioned earlier. Movement matters. Regular aerobic activity and even daily walking promote blood flow to the brain and support neural health. Hydration matters. Mild dehydration can make attention and recall worse. Dietary patterns that emphasize whole foods, vegetables, fruits, lean proteins, healthy fats, and fiber support vascular and metabolic health. Social engagement and cognitive stimulation, reading, conversation, learning new tasks help maintain neural networks. Reducing excessive alcohol and limiting ultra-processed foods also help. None of these are magic, but together they form a robust, practical plan. For caregivers and family members who notice changes, a practical approach is helpful. First, keep a simple symptom log for a few weeks. Date and brief note. Forgot appointment. Paused for name. Got lost on familiar route. More irritable than usual. Bring this to the clinician. Second, prepare a current list of medications, including over-the-counter drugs and any dietary patterns that could matter. Third, ask explicitly for a B12 test and, if available, MMA or homocysteine, and a CBC with MCV. Fourth, ask about sleep. If the person snores loudly, wakes gasping, or falls asleep during the day, mention the possibility of sleep apnea. Finally, ask about next steps. If labs are abnormal, what treatment does the clinician recommend, what monitoring will be done, and what functional changes to expect and when? I want to return to the idea of thousands in the headline. Researchers and clinicians have repeatedly observed that when common contributors like B12 deficiency or sleep-disordered breathing are identified and treated, many older adults experience small but meaningful gains in clarity and confidence. The phrase, restoring the memory, overpromises a universal cure. What's accurate and important is that patterns of intervention, testing, targeted treatment, and consistent supportive habits are helping many people regain pieces of their cognitive function. The ritual of a morning tea, thoughtfully constructed, helps with adherence and offers antioxidant support. It is a practical, feel-good habit that complements medical care, not a replacement for it. Before I close, let's summarize a clear, actionable plan you can follow today. Notice and log. Keep a short record of memory slips and related symptoms for 2 to 4 weeks. Test. Schedule basic blood work that includes serum B12 and a CBC. Ask your clinician whether MMA, homocysteine, or active B12 would be helpful in your case. Discuss medications and diet. Review metformin use, acid-suppressing medications, and dietary patterns with your clinician to see whether they could be contributing. Follow clinician-guided treatment. If deficiency is confirmed or strongly suspected, work with your clinician on a tailored plan, oral supplementation or injections as indicated, and agree on monitoring intervals. Build supportive habits. Adopt a morning ritual that includes hydration, a warm antioxidant-rich drink paired with a fortified food or clinician-recommended supplement if needed, a brief movement or stretch, and a short cognitive warm-up. This tea ritual supports adherence and overall brain health. Be patient. Expect blood improvements in weeks and neurologic gains over months. Improvements vary by individual and by how long the deficiency persisted. Watch for urgent signs. Seek immediate care for sudden rapid decline, new balance problems, spreading numbness or weakness, severe personality changes, or abrupt vision or speech problems. If this conversation has resonated with you or someone you care for, the immediate next step is practical. Schedule the lab work, bring the symptom log to the appointment, and ask your clinician specific questions about B12 testing and whether further evaluation is needed. If you want a guided walkthrough of what your results mean, how to read a serum B12 alongside MMA and homocysteine, and which combinations typically prompt treatment, watch the next video in this series, where we unpack real-world examples and provide a checklist of questions to bring to your clinician. A final note of encouragement: small changes matter. Recoveries are often incremental. Fewer blank moments, steadier conversations, more confidence. Those are not trivial. They are real quality-of-life returns. The tea is a beautiful and practical anchor for a morning routine that helps you take the other steps that truly make the difference: testing, treating, and sustaining brain-friendly habits. Notice, test, act, and be patient. Talk to your clinician. And if you'd like a follow-up that helps you read your lab results and prepare the right questions for your appointment, watch the next segment.